Everyday stress may boost blood vessel dysfunction in people with depression. The primary article that I looked at for this week was called Self-Reported Everyday Psychosocial Stressors Are Associated with Greater Impairments in Endothelial Function in Young Adults with Major Depressive Disorder. This was taken from the Journal of American Heart Association, and the research was done at Penn State. While it is known that there are associations between psychological stress, depression, and increased risk for cardiovascular disease, no studies have examined the relationship between naturally occurring psychosocial stressors and the direct effect on microvascular function in adults with major depressive disorder, or MDD. These researchers wanted to look at whether young adults with MDD who are exposed to everyday psychosocial stressors would exhibit more impairments in endothelial-dependent dilation, or EDD, in comparison to non-depressed adults and depressed adults that do not experience psychosocial stress exposure. The participants included 43 healthy adults who did not have cardiovascular disease, did not use tobacco products, and were recreationally active. All participants also went through a screening for symptoms of depression in which MDD was confirmed or not. On the day of the experiment, the participants were asked to report any psychosocial stressors that had occurred in the 24 hours prior. Examples of this included arguments with a friend or family member, or a stressful day or event at work. Then the researchers wanted to measure the endothelial function by inserting a tiny fiber under the skin of the patient's arms. This fiber then allowed them to administer a small amount of the drug acetylcholine every 5 minutes for 30 minutes, which then affected the blood vessels in the area. The researchers then looked at how the drug affected the endothelial function in those vessels. They found that there was a significant interaction between experiencing any psychosocial stressor and depression status in predicting endothelial function. Experiencing any psychosocial stressor during the previous day did not affect endothelial-dependent dilation in the healthy controls. However, in contrast, in patients with MDD, experiencing any stressor was related to more severe impairments in acetylcholine-induced dilation. The secondary article from neurosciencenews.com was called Everyday Stress May Boost Blood Vessel Dysfunction in People with Depression. I thought that the secondary article could have provided more background information. However, I also thought that the secondary article made the primary section of methods and results easier to understand. The secondary article included quotes from the primary author of the primary article concerning what research might come next. I thought this was fine to include, but more important background information on the present study could have been given. Overall, I would give this secondary article 4 stars.